boy.
Oh, it feels so good.
Oh, another 20 bucks. Even just pressing here. Oh, yeah. What's up? It's Shadle's Table. Today we got Sean coming in. Sean has been on our channel before. Super high level runner turned triathlete, turned maybe bodybuilder, not sure. He's been lifting a lot of weights, but he recently had knee surgery. So he's coming in, he's tight, he hasn't seen me for a long time. We're gonna see what he's got going on. Looking forward to this session.
So I was running every day, that was kind of the main thing, and then happened to be playing a little pickup basketball and went up to jump and just felt a pop, and I think that was like a partial tear, and then kept running, and then eventually it just fully tore. I'm kind of bow-legged, so they did a high tibial osteotomy on my right leg, so basically they saw through that tibia bone and so they basically break your leg and then straighten it out. They have this tool called, I think it's called the bone spreader, and they just like straighten it out. It's kind of wild.
And how long ago? How long did you get the surgery?
About 4 months ago.
So main goal is a little bit of swelling on the inside of the knee.
Yep.
See if we can kind of loosen up some of the muscles around the knee. See if we can increase the range of motion a little bit. Break up some of the fascia.
And that quad hamstring gets pretty tight.
Yep. All right, so we're gonna try to go easy on this young lad here. So we're just gonna check both quads out, kind of compare, see if I can feel a difference between the two. I just want to keep in mind Sean's had some trauma here. You know, any injury that takes you out of doing the things that you really love will create some extra stress and trauma in the body. So we're just gonna take our time. So yeah, we're lacking some dorsal flexion on the right side. That would definitely help squatting mobility to improve that. Yeah, your right ankle's tight. Lacking some inversion. We don't necessarily have to start with the knee. We can think about going above and below. You can see I'm just going over this outside part of his calf. And you know, earlier we know that he's lacking some inversion in his ankle, and he's also lacking some tibial rotation. So maybe if I open up the outside of this calf, he'll be able to improve his ankle mobility. If he's able to improve his ankle mobility, he'll be able to improve his knee mobility and his hip mobility.
Oh, it feels so good.
Feels so good. I'm glad you're having a good time. Me too. Anything that feels like it's not so gooey and supple. There's a lot in there. How's all this feeling down here?
A little tender, but not too bad.
Yeah. We can bend the knee here, just lightly sit on his foot so his foot doesn't slide out. And now we've got a shortened calf. Because the calf is a little bit shortened, I'm able to see if there's some restrictions in there. There's a ton in his calf. If I'm not sure, you know, I mean, because he's a runner, maybe I want to go and see how his other calf feels. There's definitely other stuff in his other calf too, so well, maybe we want to look at the pattern. So outside of the calf, inside of the calf, middle calf, kind of comparing both sides. How does the outside left calf feel to the outside of his right calf? And pinching is if you're strong enough, you can just pinch the tissue and then just wait and hold. And then you can see some good twitch in there in his calf. Yeah, there's a lot in this calf. I'm just pinching and pulling and kneading, and anywhere the fascia isn't really moving, I'm just trying to get it to move. Pretty tender down here in the lower part.
Mm-hmm.
Yeah. Lower peroneals, peroneus tertius and brevis, just on the outside of the ankle here. Did you have any pain when you were running?
It's just kind of soreness.
Yeah.
I don't know. It's
In the knee?
yeah.
Yeah. So you can see when I give him dorsal flexion, his knee just kind of pops right up. It's most likely his calf is still so tight that these things aren't really moving, sliding and gliding, and so the knee just kind of bends up to compensate for that. So we don't want that. Nice and gentle. Any issues with that?
Nope.
It's pretty good. Less restricted here. Check the hips using the knuckles, lower glute rotators. Definitely feel some restrictions through the rotators. You can tell that it's hard for Sean to relax, so that's a cue that's letting me know it just shouldn't be that intense or painful at this pressure. So I know that's an area that I need to focus on. Check the IT band attachments and TFL. That's probably one of Sean's favorites. We've worked that before on him. Woo boy, how's that one? That's spicy. You can see even just pressing here, I can see how the IT band there, just going across his IT band from just hitting the hip. So a great way to affect the IT band is to work the TFL. I know got a lot of stuff going on the right side, but the fascial system is one system, a system of tensegrity, a system of balance. Yeah, this left glute feels super bound up. Let's have Sean take a nice deep breath. He's gonna just try to let go. So when there's areas that are very taut, like it just feels like a lot of broad tissue, a lot of surface area is tight, I'm gonna maybe give him some broad, deep pressure and not move. I'm just gonna hold this. So instead of moving, just deep pressure, holding it, letting the body kind of figure it out.
You love that.
Oh, another 20 bucks.
I think I'm up to about 200 now, maybe.
I kind of 2046, dude.
Also gives Sean an idea of the rest of his body. It's sometimes hard to tell the state of your body, and then somebody works on it and you're like, oh, damn. I knew I was tight, but... Yeah, it looks like you still got a tiny bit of dead blood back there.
I think part of that is from the brace I was wearing.
Oh.
It was like kind of rubbing back there.
Okay. Checking the hamstrings. Let's have you go face up again and make sure we hit that quad. Just using the palm, my hand, letting his fascia dictate the pace. Just trying to peel everything apart. We don't want any stickiness in here, so we're just trying to spread everything apart. you know, we only have so much time, so I want to spend a lot of time in where I feel like I'm going to maximize the end result of this session. So it would make sense. You would think he's got this knee problem, we should just work on the quad, but you can definitely feel how restricted his calf is, and he's basically confirmed that his calf was atrophied. We can see that the ankle lacks a lot of range of motion, and if we make a difference here, it's going to have a big effect on his whole body. Lots in there. Starting feeling more like it's opening up now. I can start to feel the muscle here. Really open this up. He's not going to be able to really relax to this, but we're just going to go grand finale. This is the dessert after the dessert. Are you able to like kneel on this knee? Do you have any issues with that?
Yeah, I can't really do that too much yet.
Yeah.
A little bit, but
Yeah, not quite there.
yeah.
Go face down for me. Yeah, how was the PT?
I mean, I would say it's pretty smooth sailing, but yeah, that's over the course of 4 months.
Yeah.
I get helped being in the gym every day.
Definitely.
Oh man.
Oh yeah. Just because his back is tight as hell. Nice. I can see your back twitching through your shirt. Pushing the erectors right off the spine there. Just pushing the lat. Yeah, wow, I can feel that in there. All right. What year is it? Look at this guy's face. You said your knee felt a little sore when you came in. How does it feel now?
Yeah, definitely better. Yeah, especially just walking, like moving side to side a little bit, definitely better. Anytime I have like any kind of lateral motion, definitely like feel it right in there.
And now it feels
yeah, it's better.
nice.
Yeah, yeah.
On the right track.
Need to keep doing this.
Yeah, you do. All right.
Sweet.